Welcome to the NAHA webinar brought to you by the National Association for Holistic Aromatherapy. To learn more about NAHA, please visit www.naha.org. Tonight's presentation topic is Clinical Aromatherapy, Inhalers, Pranayama, and the Polyvagal Theory. This educational webinar is being presented by Jaime Vinson. Jaime is a registered nurse and registered yoga teacher. She is the Holistic Nursing Coordinator at Parkview Health System and the NAHA Director for Indiana. With her strong background in holistic modalities and excellent mentorship, she has found her passion in holistic nursing, nursing research, quality improvement implementation, and healthcare innovation. Jaime holds many certifications and teaches both locally and at the national level on multiple topics including aromatherapy, holistic nursing program implementation and certification, polyvagal theory, sound therapy, research, as well as other complementary modalities within the healthcare setting. She also conducts research in the holistic nursing field. For more information on Jaime's upcoming classes and holistic nursing certification prep course, please visit www.parkview.com/careers/continuing education/holistic-nursing. So I'd like to just take a moment and welcome Jaime for being here this evening and presenting on this unique topic. And I am so happy that you're here doing this. So thank you.
Thanks, Kelly. And here's my little approval for those continuing education nursing credits that will be available. You do have to be present for the whole webinar, and then you'll have a link at the end to the Survey Monkey, and you'll take that survey, and that's just your feedback. There's no test, and you would leave your email address, and then we'll send that credit to you via email. So I am the Holistic Nurse Coordinator here at Parkview Health System, and that's in Fort Wayne, Indiana, and surrounding counties. I've been a holistic nurse for a few years now. I've had that certification, but I really found my calling in healthcare implementation of those complementary modalities and how we can really yoke together, what we're doing as aromatherapists and, registered yoga teachers, acupuncturists, chiropractic care. How do we integrate that into the healthcare system? So lots of great things happening in healthcare right now, and I'm just so honored and blessed to be living in this day and age, and exciting things in the future. So my objectives here tonight are why our inhaler is a perfect method to deliver aromatherapy in the hospital. What is pranayama? So if we have any non-yogis out there, we'll get a little education on that yogic practice. The polyvagal theory. Now this is a pretty big theory, so it is going to be just brief. I will talk about a couple of different books where you can dive a little deeper. Strongly recommend that. It is a beautiful theory on how the mind, body really do connect. So we'll talk about how all those things work together. So my story, I'm going to start my story with my daughter. And the story is my own experience on how you really handle that pushback when you are in healthcare, like, aromatherapy, it doesn't work, or I don't believe in that, blah, blah, blah. We hear all of these things. But what you can do and how you can handle that pushback and really hold yourself up and talk about what we're doing. So last summer, that's a picture of my daughter at her after her ballet recital, And you see her broken arm there. That was the second time that year. So we're in the emergency room, and we're in our little bay, and the doctor comes in, and he's like, "Oh, Jaime Vinson. Well, I know you." I'm like, "Oh, great." You know, when a doctor knows who you are and you don't know him, you might have to worry. Anyways, he's like, "I know you. You're that holistic nurse. You're the, aromatherapy person." I'm like, yeah, I am. What what can I do for you? He's like, "Well, you know, I think that those inhalers, there's something to that." Okay. What are we going to get? Um, he goes, I don't think it's the aromatherapy. I don't believe in that stuff. But I think it's the deep breathing. That's what it is. Okay. Well, yeah, deep breathing. That's awesome. So you're telling me that you used one of my aromatherapy inhalers to sit down and take some deep breaths and you felt better, right? Well, yeah. So does it matter if you believe in aromatherapy or not? If you felt better? It's like, huh, yeah. So he got it. It doesn't matter that you think aromatherapy works or not. If you can sit down and you can be intentionally taking that deep breath, the aromatherapy is going to work. They don't have to believe it or not. And it works with that deep breathing and some of the other things that we're going to talk about tonight. So I'm hoping that I'm going to give you some firepower to be able to handle that pushback from any resistance you might get in the healthcare field. So we ended my daughter got her cast, and we ended on a good note. He's like, yeah, I think these things will work. So it was awesome. It really was a great experience. Sorry about that. So why are inhalers really the best way to deliver aromatherapy in the clinical setting? Well, they're single person exposure. It doesn't affect the people around them. People coming into the hospital often have respiratory issues or can be hypersensitive to smells, and we have to really be cognizant of the people around us. I would love to fire up a diffuser in my office and just let it waft into the hallways, but we can't really do that because you'd never know who's walking by and what kind of reaction they're going to have. And it's just not the place for that here. So that single person use of that handheld inhaler really directs the aromatherapy to that one person, that one target person, that patient that you're trying to deliver aromatherapy to. It also doesn't introduce moisture into the environment. Our cool mist diffusers, they're introducing humidity into the healthcare environment, and we don't do that in the hospital. There are no humidifiers other than like the bubblers on the oxygen, and that's delivered directly to the person. It's usually a more dry environment to keep those bacteria down. Another thing about the aromatherapy inhaler, it doesn't need to be cleaned, so we don't have to worry about that. It's one person, you use it, it's done, they can take it home with them, and they are cost effective. So they can be $1 to $2 per inhaler, depending on what you get or who you get them through. So that's not terribly expensive. Pardon me, I've got a cough tonight. I do apologize. In the next slide, you'll see a pill bottle being used for the inhaler, a couple of different options we can do. This also encourages the deep breathing. So those handheld inhalers, when they bring them to their nose, they really encourage that deep breath, and that deep breathing is something that us nurses do encourage to help prevent pneumonia, help open up those lungs, moving those intercostal muscles, exercising that diaphragm. If anybody has been in a hospital bed, you can probably concur that the hospital beds do not put you in the best position for deep breathing. So using the inhalers and promoting those breathing exercises is really beneficial, even on another level. So the picture on the left is that pill bottle type inhaler. So inside this, there is a cotton ball with a drop or two of the marked essential oils. This did come from social media. This was shared by a friend, and how they are doing it at their hospital. The picture on the right are our holistic nursing aromatherapy inhalers here at Parkview. And we have orange, lavender, and peppermint. So the inhalers, they can help support the small businesses. We do work with a local distributor who makes these, and she makes them specifically for our hospital with our holistic nursing logo on it. And, you know, I really support small businesses, and I think this is a great opportunity to get involved with some local vendors. There are blends available. You don't have to make the blends. They're already together. But if you do decide to have an actual aromatherapist in your healthcare system who is doing the pill bottle with the cotton ball in it, it's best, and you always should have those MSDS available. So those material safety data sheets, in case there is a spill or someone gets things on their skin, or if it is ingested, those things do have to be available. So if you're bringing a bottle of essential oils into the hospital, make sure you have that with you, and make sure you've talked to your manager or whoever you need to before you go and implement this practice. We want to make sure everything is approved and, you know, good to go in your hospital, because we don't want that negative pushback. Don't want to be known for those things. The great thing about this pill bottle method is that you're able to work with the patient's personal preferences a little more personalized with them than you are the handheld inhalers. Of course, having a few different ones to pick from is definitely great. So the distribution of these handheld inhalers, and I'm going to talk about the handheld inhalers specifically and not the pill bottle cotton ball method. This is a nursing measure. It doesn't take a physician's order to do. Our patient care techs are available and able to hand them out and work with patients and teach them those deep breathing. It makes aromatherapy easy to do. You know, anybody can do it. One thing I do really like about giving them this personal inhaler and sitting next to them and doing some breathing and really talk to them about, you know, take a deep breath, and what each essential oil would do is it cultivates that caring relationship between nurse and patient. We try not to give them to young children who might stick them up their nose or in their ear or in various places. You know, don't give it to somebody who might not be as cognitively functioning. We don't want them to hurt themselves. You know, just be mindful of that shelf life. You need to place smaller orders. You know, and this is something we have to teach some of our healthcare excuse me, administration. Managers, they like to buy in bulk and, get the cheaper price, but these do have shelf life. And we don't want to be handing out rancid inhalers to people and telling them to take a deep breath of some rancid oil. We need to be mindful of that and order the smaller batches. And if you do work with a smaller distributor, make sure they let you know if the blend does change and to update that with your hospital and the approval. So this brings me to pranayama. So pranayama is a yogic practice of breath work. The translation is quite literally life force and the control or restraint of that life force. So it's breath work. Some of the techniques are a little more advanced. I would definitely make sure you're with a practice yogi if you're doing some of the more advanced stuff. But there are very basic and very simple things that we can do and we can share with our patients and even use on ourselves. I love having the inhalers available on the floor when I'm working, and I've got one for myself if I need it. Sometimes just a quick little sniff can give you that boost and clear your head. So Nadi Shodhana is that alternate nostril breathing. So that's the exercise you see where people have their hand or their finger on one of the nostrils. They breathe in through one side, switch fingers, switch nostrils, and then breathe out the other side. Breathe in that same side, switch nostrils, and then breathe out the other side. Ujjayi breathing. If anybody's been to yoga practice and laid in Shavasana and heard all those yogis breathe that sound of the ocean, that is that yogic breath. Kapalabhati is skull shining, and that is more of an advanced practice. I don't suggest starting out with that. Circa breath, this is our three-part breathing. Cloud breathing, it's often called. We use this in labor and delivery sometimes. We use this on the floor. I've seen some of our therapists use this. Brahmari, and that's bumblebee breath. This is my favorite yogic pranayama to use with children. So this is bumblebee breath. And the simplest way to do it, there's different ways, but the simplest way is to teach kids to take a deep breath, close their eyes, put their fingers in their ear, and hum. So this can really calm kids down. It kind of puts them in that safe space and really gives their body a cue of safety. And humming is just great practice. A lot of yogis om. Humming is very effective as well. So when we do these pranayama practices, we are exercising our diaphragm, our intercostal muscles, and those intercostal muscles are the little bitty muscles in between each rib. Our abdominal muscles, we like to tell people to draw their belly button to their spine and really press in. We're using the muscles of the neck and the collarbone as well. So each type of pranayama offers a different benefit or a different sensation. It's either going to warm up our body and create that fire, or it's going to cool us down or bring us into the present moment, or bring us into a different state of consciousness. So some of these pranayamas, they can cause a pH shift in the body. So that hyperventilation that we have with the skull shining, really causes the pH of the blood to shift and become a little more alkaline, and that causes a lightheadedness sometimes. So make sure if you're doing some of the advanced practices that you are with a yoga teacher or someone who is practiced in that pranayama. So we're going to try some breathing at home. If you have your inhaler with you or your favorite oil, go ahead and pick that up. So we're going to do some cloud breathing, and that's the 4-7-8 breathing. Pardon me. So we'll breathe in for 4 counts, hold for 7, and then exhale for 8. This is going to help calm the body, can lower your blood pressure, and increase the lung capacity. So does everybody have their inhaler or at least an oil with them? I'm going to grab mine too. We're going to start. I just want you to put your hands in your lap, or if you've got your inhaler, pull your inhaler up to your nose. And we're going to breathe in. 1, 2, 3, 4. Hold. Exhale. Inhale. Hold. And exhale. Really pushing that belly button to the spine, emptying out our lungs. Inhale. And hold. And out. In. Exhale. Really moving that stale air out. Pressing the belly button to the spine. And we're going to breathe in. Hold. Exhale. Inhale. Hold. Exhale. Inhale. Exhale. And breathe in. Hold. Exhale. Inhale. Hold. Exhale. We're going to take a couple of good, clean, cleansing breaths just at your own pace. big, full, deep breath in, stretching that abdomen all the way out as far as it'll go. Hold. Hold for just a couple counts if you like, and let it out with a big inhale again, deep breath, all the way down past your belly button. And exhale, audible exhale. Last one. Inhale. And exhale. All right. So most of the time we breathe really shallow and we don't really use all of our lungs. When we take the time to really think about that, you notice how much we don't use our full lung capacity. Really sitting down and doing these breathing exercises brings you into the present moment. You bring your mind to the here and now, focusing on your breathing. A lot of times this is distraction for our patients who might have some pain issues, or even if you're not feeling that great, taking that big cleansing breath. I know that works if my back hurts and I've just been at it all day and I've been nursing all day and I have heavy patients and I've been on my feet. A couple of big deep breaths actually helps my back. It feels good. And then, letting those breaths go and really cleansing my body with my breath. That really helps get through the day. So we're going to briefly talk about polyvagal theory. Now this is, there's a lot to this. Dr. Stephen Porges, he originally started some research on heart rate variability and biomarkers of focus and function in the 1960s. So in about 1994, he really put out polyvagal theory and put that out, and it explains so much of this mind-body connection and why we feel the way we do in certain situations. He does have a few books, clinical applications for polyvagal theory. That is a pretty easy read. This is going to talk about the different settings. I do believe is there a yoga in there? Anyways, there are some nursings, there's some different trauma therapists who share how they use polyvagal theory in their practice. I definitely strongly suggest that one to start with, or the Pocket Guide to Polyvagal Theory. The first one that was published in 2011 might be a little deep for some. He has published many scholarly articles and research articles, and this actually dates back past 1994 to the 1960s when he was doing his original research on heart rate variability. Polyvagal theory, though, does describe the evolution of the vagal nerve and how it connects to our whole body. Takes a deeper look at the autonomic nervous system, and he also coined the phrase neuroception. So as we evolved, our ancestors were reptilian, and we share a non-myelinated vagus with most vertebrates have a non-myelinated vagus. So as we evolved into mammals, we developed this myelinated vagus nerve. And this vagus nerve allowed us for social engagement. It allowed us to be in close proximity with other people and not feel threatened. If you've noticed, if you're an animal person, you'll notice that reptiles really don't stay in social packs, other than they come together to mate, but they really don't, herd. But when you look at mammals, they often rely on each other or their pack to survive. Humans, this is especially important in. So we're going to talk about the 3 autonomic nervous system responses. So fight and flight, we're really familiar with that. So we talk about fight, flight, and freeze anytime we've taken any anatomy or psychology courses, and we talk about how we're scared and you go into your fight flight response. Well, yes you do, but there's something in between, and that's the social engagement. The myelinated vagus allows for that, and it shows your expression on your face is connected to your vagal nerve. So there are different nerve complex in your face that go to your heart and even your guts, even your bowels and colon, and we're really connected. They all really run on this same circuit or are connected to this same circuit, and they all come together in the brainstem where all this processing takes place. We needed to be able to read the social cues of others to know whether our environment was safe. So you can see this in dogs. This is very easy to see in animals, and how they read each other's expressions. Have you ever seen somebody who's just not very approachable, or you don't feel comfortable approaching or talking to? This social engagement, and there are people that you meet and they've just, they've got that smile on their face, and you can see those crinkles and those eye creases in their corner of their eye, and they're very approachable. It's part of that neuroception. So it's this instantaneous feeling and knowing whether your environment is safe or not. So I didn't mean to do that. Sorry. We use these neural circuits first. So we use the myelinated vagus first, the one that's mammalian, that we developed for the social engagement. But when that fails us, and when our body is in an unsafe state, or we feel threatened, things like death feigning, even dissociation, and trauma can happen. So what happens is they recruit that older myelinated vagus that we share with reptiles, and our body kind of shuts down. It goes into almost a state of hibernation. We reduce that metabolic need, and people pass out. If we're looking at the animal kingdom, a mouse that's in the jaws of a cat, that mouse isn't often dead, though it looks dead. That's death feigning. So the mouse is dissociated, so it doesn't feel that pain. We see this death or this trauma response often with people who have been sexually assaulted, or they couldn't do anything, they couldn't move on. This is that old vagus recruiting their body for protection, and kind of taking their brain out of that so they don't feel the pain. It's very interesting. We're going to go ahead and move to the next one. So the vagal nerve, this might help clarify things. So this picture shows the vagal nerve and all the things that it's really connected to. It's your 10th cranial nerve. It's bidirectional. So it doesn't just, send feedback to your brain, but it sends signals from your brain to your gut, to your heart, to your bowels, to your voice. It's really, have you ever heard a kid who is obviously anxious say their tummy hurts? Kids don't often, come to say, I'm anxious. I don't want to go to school today because this math test is, I don't want to take it. They'll come to you and they'll say their tummy hurts, and they really, really do mean it. It's a physical manifestation of that emotion, and it goes down into those subdiaphragmatic organs, and you can really feel the anxiety. Another thing is a broken heart. When we're sad, it physically hurts in our heart. Our voice, when you're nervous, you can hear the voice crack. When we hear moms talk to their babies, they're usually in a soothing, melodic voice. When we're trying to coax an animal towards us, we use that same voice to, here puppy, come here, trying to coax them to us. We don't use the low voices and come here, we don't do that. We have to use these soft ones. And our vagus nerve is directly connected to the larynx. So that recurrent laryngeal, oh my gosh, I'm sorry, laryngeal nerve. And it translates, your emotions do translate in your voice. So I try to explain this to people by, can you hear in somebody's voice if they're lying to you, even though you have no reason to believe they're lying? Sometimes you can hear this, and it's quite literally their mind and their real intentions translating through their voice. So there are some different portals for manipulating our cues of safety through our vagus nerve. And again, this is through sound, and that's that melodic voice, singing, breathing, even different postures. So postures have been used throughout history to calm people. We bow our heads when we pray. Yoga, we go into child's pose. This gives cues from your baroreceptors and your veins. So the way your blood shifts and the pressure that's exerted on the inside of your veins cues the body as to if you're in that calmed position or not. These can also be seen in eating. So like breastfed babies, that they've got to coordinate the suck, swallow, and breathing. So that's done through the vagus nerve as well. So we're going to talk about the intentional manipulation of breath with the polyvagal theory. The slowed breath helps calm the body. It affects your heart rate variability. So there is what Dr. Porges coined as the vagal break, and this is the parasympathetic nervous system. So that rest and digest nervous system that we talk about, that calming nervous system, when we breathe out, that's really engaged, and our heart rate slows just a little bit. But as we breathe in, that break comes off just a touch, and our heart rate speeds up. Excuse me. So this vagal break is there, so when there is that fear or that fright that happens, it can be immediately removed off the heart, and we can engage that sympathetic nervous system and respond in a flash. So when we are trying to recruit the vagus nerve to serve us for relaxation, it is very important that we use longer exhales and shortening our inhales. That's how that cloud breathing works. Triangle breathing, very similar. It's called a few different things, box breathing. But anytime we make those longer exhales, we're actually slowing our heart rate just a touch. So you see this, of course, in yogic practice, but the longer inhales, so this is interesting, and the shorter exhales, you can see when people are trying to pump themselves up, like professional athletes or professional fighters or football players on the sidelines. They're knowing they're going to come up and it's their turn to go on the field. They're huffing in and often making those audible exhales really fast. The big and they're pumping themselves up. They're physically removing that vagal brake to get their body in that fight-flight mode. So they're really getting those adrenals pumping and getting themselves ready to grow. So when we intentionally recruit this myelinated vagus, the one that either slows or raises our heart rate, we're talking about social engagement. So social engagement is, again, how we're close with people and we are not at fear that they're going to kill us. We need to be able to immobilize, but not in the same way that reptiles do. We need to immobilize and feel safe around each other, but still be able to interact. Play is another form of social engagement where it's actually the reverse. You're mobilizing and in that space, but you're not in fear. So when we play, we're using a lot of facial cues to see what the other person is feeling and get that feedback. So I'm going to talk about the synergy of how you put all of these things together. So we're going to talk about essential oils. We all know that aromatherapy does have an effect on the body and how it can be used to treat nausea, pain, decrease our depression, increase appetites, help with sleep, help with respiratory issues. There are so many benefits, so many different essential oils that we can use or we could implement in the hospital. There are different blends we could use for the hospital. Lavender, of course, that promotes calming and promotes sleep, good rest, helps with some headaches, I feel. Orange, that's emotionally uplifting. I feel it can be calming, and I just love orange. Peppermint, we use our peppermint inhalers here a lot for nausea. Promoting focus, the nurses do like them to clear their heads and promote that focus. Principles of pranayama. So we're talking about using those auxiliary muscles and calling attention to the present, and not thinking so much about the surgery, the impending surgery, or going home and how are you going to get around after you've broke your leg, or kind of takes the mind out of being in the hospital and really just puts them in their body for a second. Teaching them to control their breath, that can help with get them through those painful times when maybe they don't have any medication that's available. They may have been maxed out on their medication, or they just don't have any prescribed or don't want to take it. teaching them some of these breath works, they can work through some of that pain. And of course, it's good for the prevention of pneumonia and things that we don't like to have here in the hospital. So the polyvagal theory, this really talks about the neurobiology and the neurophysiology of how our heart reacts and how our mind reacts to this deep breathing by recruiting that vagal nerve and that manipulation, that portal, that cue of safety, those long exhales. And I did want to add here, I see that that these long exhales, this can help with tummy issues too. So when you're getting right down to the root of some tummy issues sometimes, it really is that anxiety. And if you think back to the slide that showed the vagal nerve and how it's attached to so many of our subdiaphragmatic organs, if we just relax it a little bit and let our body do its thing, that rest and digest, and pull it out of that fight-flight mode and really recruit that parasympathetic nervous system, we're promoting the relaxation of the nervous stomach, I guess, for lack of a better word. Another thing, we like to encourage the deep breathing in the hospital. We're moving the air down into those lung bases and really moving that volume in and out of our lungs. This can help move out mucus. So we do see a lot of pneumonia and flu and just yuck. It helps oxygenate our blood and boosts our circulation. And you have to have good oxygenated blood for healing. And it lowers the risk of lung complications like that pneumonia and those infections. So when you put it all together and you are meeting some resistance from maybe your administrator or peers or colleagues in the hospital setting who say, you know, aromatherapy doesn't work, or, you know, it doesn't have a place in the hospital or a place in allopathic medicine, you can really fight back when you talk about the different things that we talked about tonight. It gives you a platform to stand on when that resistance comes to you. They're a cost-effective option. So you're not talking about $4 and $5 for each patient, and you know, it's not a huge cost on each unit or each hospital. You know, budgets are tight. Not every hospital has a great, huge budget they can draw from. So being cost effective is really, you know, if you're going to speak to the hospital and get something done, you really need to talk to their fiscal ear. They really want to know, you know, how is this going to help? You know, it's a low cost intervention that really boosts up patient satisfaction, really gives that nurse that time and that opportunity, or even that patient care tech or that volunteer, to go in and spend some one-on-one time with their patient. When you sit down and you spend that time, that one-on-one, that face-to-face with your patient, just that 5 minutes can really mean the world to them. You can spend 20 minutes in their room, you know, charting on them or doing your assessment, and that doesn't mean anything to the patient. It really doesn't. But when you take your time and you sit down next to them and show them how to care for themselves, or give them the inhaler or that personalized attention, they really do feel that you were there longer than what you really are. So that's great. These inhalers, these handheld inhalers, are easily personalized. As you saw in the photo, it has our holistic nursing logo on it. They can be personalized for the hospital. Even the blends that you get put in them, you can personalize those as well. You know, just find a company or a small local company, or any of the, wherever you would like to go, and ask them about it. You know, do your research and take a look around. Promoting that human connection with the patient. Again, that's about sitting there and being with the patient and knowing that, you know, you saw that they were maybe in distress or had trouble sleeping. So you took the time to grab them that lavender inhaler and go in and show them, hi, you know, my name's Jamie. I'm your nurse tonight, and I heard you had trouble sleeping last night. I brought this inhaler and I thought maybe it would be helpful. Would you like to see how it's used? Can we use it together? You know, can I explain this to you? And they really enjoy it. Again, it's an option when maybe pharmaceuticals are not an option. So teaching those breathing techniques with the use of inhaler. Sometimes we can't give them anything for nausea, or there's no options for any more pain medication, and it gives you something to do. And you know, your patients notice that when you go out of your way and you give them something. You give your patients a sense of control and autonomy over what's going on. You know, they come into the hospital and often they feel like these things are ripped away from them. You know, they're getting the antibiotics, or they're getting this and they're getting that, and there's the labs coming in and it's on this schedule and on that schedule, and they don't get a chance to really do anything or direct anything for themselves, and it gives them that sense of control, and it makes them feel like they're doing something for themselves. And another thing is, these handheld inhalers, they can take them home with them. And I can't tell you how many times I've been in the community and, you know, ran into somebody and they're like, oh yeah, I was there, I had surgery and they gave me this inhaler and it was awesome, and here it is in my purse and I really like this, where can I get more? They remember the nurse that handed them that inhaler or talked to them about, you know, deep breathing or their aromatherapy. So I just want you to know that there's so many things when you're coming in to talk to either a healthcare provider, or if you're a nurse and you want to implement aromatherapy on your unit and you're starting to get this pushback. There's a theory that you can use, and that's the Polyvagal Theory, and that it does change your heart rate and it does promote this deep breathing. And, you know, we're always trying to get our patients to deep breathe and cough, use their incentive spirometer and move that air in and out of their lungs, or get into a better position to breathe. These inhalers are a great way to encourage your patient to do that themselves. I think they're a perfect tool. There are other methods to deliver aromatherapy in the hospital. I feel that this is the go-to best thing for acute care, as long as the patient is able to move their hands and wield the inhaler themselves and they're not going to stick it in other places. So that's pretty much what I have to say on majority of that. I have my references here. And if you have any questions about the books, these are all on here. They're easy to find. And I don't know why my thing isn't working. There we go. So here you're going to find my email address, my home email address, and my work email address. Feel free to reach out to me if you have any questions. That bottom link to SurveyMonkey, it would be how you would obtain those nursing continuing education credits. And then the Parkview Careers Continuing Education. We do have a Holistic Nursing Certification Prep Course retreat coming up. So that's going to be 3 days at a retreat. It's just going to be beautiful. I can't wait to do that. That's going to be in the fall. So we're going to do some sound therapy and aromatherapy and some earthing and some mindful cooking on top of it. And it's just going to be a great experience. I'm not sure if the actual sign up link is active today or if it goes active tomorrow, but it should be completely up and running by May. I know that it's open, but I don't know if you can actually register until then. So I think that's it for me, Kelly.
Well, thank you so much, Jamie. I loved it. And I think that I do meditation and deep breathing all the time, but this just took it to a different level. And it's a good reminder for all of us aromatherapists, nurses, holistic practitioners to use our own medicine for our own self, right? So that we
Yes,
stay healthy and focused and grounded when we're working with clients or in your case patients. So I think that this empowered our audience and our members. So I really appreciate you being here tonight and talking on this topic for them. So
yes,
thank you.
please. We need aromatherapy in the hospitals, and
That's
this is a
right.
great gateway. This is a good way to get it in there. It's not invasive, and it's not gonna stink up the units. It's perfect.
Well,
It's a great way to get it in the door.
the power of inhalation with the little inhaler, I mean, that's pretty powerful on different levels besides the smell. So,
It is
right.
extremely powerful.
So thank you.
Well, you're welcome. Thanks for having me.